zone. Well, the Virginia Department of Health reports 2 children have now died from the flu, marking the first pediatric flu deaths of the season. One death involved a school-aged child in the eastern region, while the other was a teenager in central Virginia. Joining us now to discuss all things flu-related is Dr. David Shaker of the Shaker Medical Group. Dr. Shaker, always good to see you, sir. Welcome back to the show.
Yeah, I thank you for having me on difficult circumstances.
Yeah, I got to tell you, obviously when anyone passes, it's a big deal. But when it happens to be children, it catches the attention of so many more. We know that only 30% of eligible Virginians have actually received the flu vaccine this season. Yet again, very concerning. And doctors are saying that this perhaps is one of the contributing factors.
So let's backtrack. I mean, this tale has 2 important stories in it, right? The first one is, let me be the first also to give a little bit of condolences to the family. Anytime you lose a loved one, it's going to be very difficult. And then when you lose a child, it's going to resonate also a little bit differently. The other consideration I always say is that this loss is not really felt just by the families, but also the medical community that's taking care of these patients. You know, these are people too, the nurses, the doctors. When you see things like this happen, it really hits home. A lot of our medical studies are based on population studies, epidemiology, but then things that happen on an individual case-by-case basis, you know, our hearts and our decisions really go to that stuff. And it always, these kind of moments always stick with us going forward. So yeah, in regards to the overall vaccine, you're getting about 35% of the Virginians that are the population that is vaccinated now, versus maybe about 42% nationally. So we're definitely trailing. I think what's really interesting in that is which groups. So the 18 to 49-year-old group have the lowest vaccination rates, the highest positivity in terms of testing, but also the lowest death rates versus the younger than 5-year-old and the higher than 65-year-olds. Those have the highest death rates. That 20 to 50 age group that we're talking about, those are the caretakers, right? Those are the people who are taking care of the young kids and also older parents. So there's an element of responsibility there. This is kind of the same concept, we say, as the airplane model, where you're asked to put your mask on before helping another person. A lot of that is because we want to make sure that we're safe so that we're able to go out and help other people.
Dr. Shaker, I remember as a kid and even into my late teens and then when I became an adult, getting a flu shot was a big deal. I mean, you just did it. It was a part of, you know, your everyday life, I should say, meaning you would do it at least once a year or whenever you're supposed to get it done. We would always do it. Now, the mere fact that folks are not opting to do just that, I'm somewhat perplexed and confused as to why not.
So look, you've geared me to my next point, and that's essentially that there's so much confusion, misinformation, and almost a distrust to doctors that, to a degree, I understand. There's just so much out there for people to consume. There's people on the left, there's people on the right, there's people that are red and blue, and it's just such a publicized topic. At the end of the day, the simple fact is the same. If you've got a sick child, if you're sick, if your loved one is sick, what are you going to do? You're going to go to the doctor. You're going to seek information. You're going to seek out help. So when it comes to vaccinations, our one plea is prevention. We are much better at it than we are at treating viruses like this, right? So when we have the vaccine at our disposal early, we need to jump on top of that rather than just wait, and just trust the misinformation or just say, well, we'll see what happens. That never ends up in a good situation. The other thing that's worth considering too is, so what's the effectiveness of the flu vaccine this year versus last year, okay, or years before? Typically, you'll get 40 to 60% reduction in medically sick or medically necessary flu, where you need to seek out help, hospitalization, something of that nature. So you get 40 to 60. Last year, 41%. This year, you're getting about 35%, which is a little bit lower, but the side effects are all the same. There's nothing hugely significant. There's no barriers to getting it. We've seen these studies done. We've had the flu year over year. And so we know how to treat it. We know how to take care of it. We just need to prevent it as much as we can.
Yeah. So, Dr. Shaker, what are some of the symptoms one should expect to face and or deal with should they opt to get the flu shot? I know before I remember getting a fever of some sort. I had the sniffles a little bit. But I'm hoping you can explain as to why that happens if, hey, I'm getting this shot to make sure I don't get the flu and I don't feel sick.
Again, Guy, it's not about preventing the illness. It's about preventing medically necessary illness, right? Where you need to seek help or hospitalization, something along those lines. Generally, the flu vaccine, it may reduce you getting it. It will definitely reduce the duration, and it should reduce the severity of it. That's why we vaccinate. No, the other thing is in your question in regards to symptoms, I gauge symptoms not based off what I have first, but is anyone around me sick, right? So the first sign that something could be going on is I've got a loved one who's got a cough or some sniffles or fever. Maybe someone at work, maybe someone at my child's daycare. Those are actually the first quote unquote symptom. Then the other things we're familiar. It's fevers, it's chills, it's body aches. You may get some upset stomach, diarrhea, which is commonly seen. It's the cough. And I'll also make a small note about the cough too. We're seeing the cough will linger after the infection is gone. So you may be sick for 48, 72 hours, and then you'll get a cough that lingers. After about a week or so, we don't suppose you to be infectious or contagious, but that cough can linger. So that's another issue with if you just kind of prevent it or minimize it, you won't have that trailing 4 to 6 week cough that I see regularly.
All right, Dr. Shaker, well, as we wrap up, I just want to make sure we're clear because we have so many parents watching right now, and yet again, 2 children now dead in the state of Virginia as a result of suffering from the flu. Are we stating, and I just want to make sure I fully understand this, that children are not more at risk with regard to, let's say, unfortunately passing as a result of getting the flu versus adults?
So the highest risk groups in terms of getting severity and mortality are going to be the younger than 5-year-old group and the above 65-year-old group. Generally, we think it's the younger group because they haven't had enough exposure. You haven't had an antibody buildup over time. So that's why the younger group is much more at risk. And the older group, because generally they come with what's called comorbidities. It's not their only illness that they have. They have other reasons to be sick. When you combine heart disease and flu or heart disease and pulmonary issues, lung problems, these things transpire much worse, much quicker. I'll also take a small note and say that RSV is another virus that's going on pretty significantly now as well. When it comes to vaccination recommendations for RSV or respiratory syncytial virus, it should be babies that are less than 8 months old. That's very common. You know someone who had their child in the ICU shortly after they were born who had RSV, and also above 75-year-olds, you should be getting the RSV vaccine. In that 60-year-old range, you should be having a conversation with your doctor to see if it's appropriate for you.
Okay. Last but not least, I know I said I had one more, but I want to make sure I ask this, and that is any parents
Don't worry.
teetering on the fence as to whether or not to get their child vaccinated, what would you say to that parent at this very moment?
I would say that it's my job as a parent to look out for my kids. So even if I'm confused, because I go back and forth with parents all the time. I go back and forth with families all the time. Even if you personally are saying, oh, I don't want to vaccinate my child, I'm taking a hard stance on this, or I don't want to vaccinate my loved one. Okay, that's still fine. You also are the highest risk group for getting the illness. Maybe you should be vaccinated so you don't take that home. And I know that's a difficult pill for people to swallow. And it's probably not what I would want. I would want everyone ideally to be vaccinated, 42% nationally. That's a failure on my end. I should be doing more. At the very least, let me vaccinate the group that's getting the highest infection. That's the adults.
Well said. Yet again, Dr. David Shaker with the Shaker Medical Group joining us right here on the Live Zone. Truly appreciate your time, sir. Thank you so much for that vital information.
Thanks, guys.